Heart failure occurs when the heart is unable to pump blood and oxygen effectively to the rest of the body, including the vital organs like the kidneys, the brain, the lungs, and the heart itself.
We have a multidisciplinary team approach for heart failure on an inpatient level, where the patients meet a nurse practitioner who specializes in heart failure. They get education both with the patient and the patient's family so the patient can succeed at home and the patient is able to contact us if there are other symptoms that develop.
The most common symptoms of heart failure are shortness of breath both at rest and with activity, difficulty laying flat at night. Oftentimes they will wake up gasping for air in the middle of the night, increased coughing, swelling in the legs, ankles, abdomen, and arms.
The patient also gets intensive nutritional education, also is enrolled usually in cardiac rehab or an exercise program right while they're in the hospital, and then follow up and transition to home where we can continue these treatments and therapies as an outpatient occurs. Initially, we just had medications to help patients with heart failure, but what we realize is the geometry of the heart in heart failure is important too, and that's where device therapy comes into play. These devices actually sit like an angel on the patient's shoulder, looking and waiting for dangerous rhythms to occur, which can occur in 30 to 35% of patients with heart failure. And if it sees a rhythm disturbance, it actually shocks the patient or paces the patient and saves their lives. We have remote monitoring of these patients, so we're able to monitor almost every patient now remotely from home.
My role as the heart failure coordinator is to meet with patients face-to-face at the bedside. I spend a great deal of time with them, talking to them about their sodium and their fluid restrictions, weighing themselves daily, monitoring for symptoms. I really go into detail with them and try to develop a personalized, individualized plan of care for each patient.
Without patient participation, we keep going down the same road with heart failure. Sodium and fluid in the diet is a really important part of a heart failure patient's regime to keep that under control.
It is a chronic illness. It's a chronic condition that can be managed with medications, diet, and lifestyle changes. Someone with heart failure can have many good days, but then they can relapse and have several bad days. Our goal at Doylestown Health is to really manage those relapses and prevent hospital readmissions.
We've been very proud of the awards that we achieved here at Doylestown Hospital. We have achieved the American Heart Association Gold Certification Award in Heart Failure and the Joint Commission Award in addition. The thing that I like most about Doylestown Health, and the reason that I've wanted to continue to be here, is that it truly is a family. There's camaraderie amongst the staff, amongst the physicians. We have an open policy where physicians call each other, text each other to review cases. We can talk to the nurses, and everyone participates in the patient's care.